Also tonight, new steps in the fight against coronavirus here in Indiana and across the country. The state health department reporting more than 3,500 new cases today. We haven't seen a daily total that high since January. Now state leaders are promising to expand testing, and the nation's top doctors are recommending booster shots of the vaccine.
Yeah, several developments on the pandemic. We want to walk you through this tonight because we know there are a lot of questions and a lot of concerns. First, two major national announcements coming. First, President Biden announcing nursing home staff will be required to get the vaccine. And number two, tonight, the White House COVID response team is recommending booster shots for people who choose them. Now, we want to start with that recommendation tonight. Fox 59's Birshel Adme joining us to break down, Birshel, exactly what this means.
Fanchon, all Americans will soon be eligible to receive a COVID-19 booster shot. Now, this is something that's been discussed as a possibility since the vaccine was first given emergency approval. And this evening, health officials are telling us it will help increase protection against the more transmissible Delta variant.
The current strong protection against severe infection, hospitalization, and death could decrease in the months ahead.
So here are the details of that plan from the CDC experts. They say Americans should get an extra dose 8 months after their second shot of the Pfizer or Moderna vaccine. Both those vaccines require 2 doses right now. The booster shots could start the week of September 20th. So why now? That's a big question. How did the CDC come to that decision? Well, the CDC director says studies show the vaccines are losing effectiveness. That's as the Delta variant surges. Data from the Mayo Clinic shows that Moderna is 76% effective against the Delta variant. Pfizer is 42% effective against it. The surging Delta variant combined with dropping effectiveness over time led to the booster recommendation.
Even though our vaccines are currently working well to prevent hospitalizations, we are seeing concerning evidence of waning vaccine effectiveness over time and against the Delta variant.
Right now, the booster shots are approved for Americans with weaker immune systems. They're already available in many places, including at Kroger. Their pharmacies have appointments available, and they are doing walk-ins as well.
Just get comfortable with the information, ask questions, talk to your doctor, talk to your pharmacist, make sure you're having educated information. But knowing that third dose is recommended to boost up the immunity and help prevent any infections and those long-term hospitalizations.
Again, boosters are available for now, and that's for people with weaker immune systems. The rest of the plan we just laid out still needs to be approved by the FDA and a CDC advisory panel. The agencies will evaluate the safety and then the effectiveness of that third dose, Fanchon.
And Birshel, again, I want to reiterate this coming from the CDC tonight. And we know a lot of people, this is being talked to and focused on with receiving the Pfizer or the Moderna vaccine. But a lot of people are wondering about the Johnson & Johnson. What if you got that vaccine?
Yeah, that's the third option that we have here in the U.S., and doctors are still waiting for more data on that. So the Johnson & Johnson vaccine, it's still the only one-dose vaccine available. Health officials believe that people who received it will probably need a booster as well, but they're still waiting on that research. It's key. The first J&J doses weren't administered, though, until last March, so 3 months after the first Pfizer and Moderna doses. So right now, those timelines are just a little bit different, but we're going to stay on top of that for you. As soon as we hear differently, we'll let you know.